Hello, my name is Rani Ansari. My topic is the mistrust of the government and how that will affect us during the pandemic. COVID-19 has horrified the world with its grasp, totaling 21 million cases and 760,000 deaths worldwide, and they continue to rise as I speak. As a response, many countries have begun taking safety precautions using modern technology. For one, contact tracing apps, which are created to alert and inform those who have come into close contact with someone exposed to the coronavirus. Some countries have even taken it further, incorporating data surveillance or tracking users' whereabouts, with police in Kerala, India even going as far as tapping phones of COVID-19 patients and tracking their call detail records. However, many are frightened of the possible hazardous implications of safety measures such as contact tracing and data surveillance, bringing privacy concerns to the front line. The cybersecurity of these safety measures is brought into question as risks of hacks and security breaches are leveled. Additionally, many wonder at what point these security measures infringe upon citizens' privacy, with some questioning government's lack of transparency, such as the collection of personal call records or location tracking without the user being aware. In fact, in Norway, the government released a smartphone contact tracing app that was met with privacy complaints and an abundance of security problems. The app has now been formally placed on an interim ban in the country, as the risks of increased surveillance outweighed the app's unproved public health benefits. Human rights groups argue that such apps place millions of citizens under unnecessary privacy danger, exposing risks of stalking, scams, identity theft, or even in some countries, oppressive government tracking, all of which sabotage public health benefits and the citizens' trust in the government. The US alone holds 5.3 million of these cases, as seen here. It's extremely red, leading all countries in the total number of cases and fatalities presented by Johns Hopkins University. With America's public trust of the government falling rapidly and past security breaches that are difficult to stomach, it is not hard to understand why some Americans are apprehensive about incorporating safety efforts that involve data analytics and surveillance. The novel coronavirus pandemic calls for urgent necessary safety methods that include data analytics, surveillance, and artificial intelligence. Still, people have the right to be understandably uncertain about trusting the government because of the lack of transparency in past instances. Okay. Understanding America's mistrust of their government. In studies by the Pew Research Center and CBS News polls, researchers found that Americans perceive trust in Washington as rapidly shrinking, especially now during this pandemic, with fake news and false information being spouted directly from the White House. Many Americans are mistrusting public health officials and local leaders. However, this problem stems much deeper than this. In 2013, National Security Agency contractor Edward Snowden blew the lid off U.S. government surveillance methods. On June 5, 2013, The Guardian in Britain published the first story based on Snowden's leaks. It revealed that a secret court order was allowing the U.S. government to get Verizon to share the phone records of millions of American citizens. Later stories disclosed other back-end snooping and how the U.S. and British spy agencies had accessed information from the world's telephone and internet traffic. Incidences like this one permanently changed how the public viewed and trusted their own government. Issues regarding personal privacy and infringements upon human rights emerged, showcasing the mounting evidence for the public to be wary about the government's lack of transparency. In fact, Edward Snowden's revelations about the NSA's telephone metadata collection program triggered an uproar in the U.S., eventually culminating in the 2015 passage of the USA Freedom Act, legislation that supporters claimed would end the kind of mass surveillance Snowden had exposed to the world. However, this is not the only case of such data leaking occurring. In 2015, a white hat hacker, or an ethical computer hacker in other words, uncovered a database sitting on the web containing various pieces of personal information related to 191 million American citizens registered to vote. Researcher Chris Vickery told Forbes he found over 300 gigabytes of voter data, which included names, home addresses, phone numbers, dates of birth, party affiliations, and logs of whether or not they had voted in the primary or general elections, dating back to 2000. He said, "Our society has never had to confront the idea of all these records all in one place, being available to anyone in the entire world for any purpose instantly." Vickery supplemented, "That's a hard pill to swallow. It crosses the line." Situations like these, even if unintentional, make it hard for the public to wholeheartedly put their trust in the government to do what is right in times of crisis, and even make it difficult to believe that the government has the public's best interests at heart. As you can see here in the CBS News polls above, the percentage of people who trust the government to do what is right is decreasing as time goes on. Understanding the implications of these apps in America. After the 9/11 terrorist attacks in 2001, the U.S. government passed the Patriot Act in order to enhance domestic security, as quoted by Tina Embinger in her article, "The USA Patriot Act: Implications for the Private Email." As a means of increasing security, the government inherently negated several privacy protections for citizens. She says, "One of the means to accomplish this was to give law enforcement increased authority for the surveillance, interception, and disclosure of private emails. Oftentimes during public crises, privacy rules are relaxed in turn for greater protection against considerable threats, as such was the case in 2001. Glenn Cohen, a professor of health law policy and bioethics at Harvard University, discusses this, saying anything has the potential of making people less safe, even if it involves giving people back some privacy they've already given up. It's just much harder to sell." After the 9/11 attacks, there was much time to debate the law and deliberate over the government's surveillance powers. However, in the case of this pandemic, there is not enough time. The total cases and deaths are rapidly rising. Countries like China, Singapore, and South Korea have already used increased surveillance to help control the spread of the coronavirus. And countries like China, Singapore, and South Korea have used increased surveillance to help control the spread of the coronavirus and limit the death toll. The Chinese government is requiring that citizens use software that automatically decides if a person must be quarantined based on contagion risk. Similarly, South Korea is using a combination of smartphone location data, surveillance camera footage, and credit card data to trace those who are infected and their movements, delivering this information to the public. Still, these intrusive methods have yet to be introduced to America, which has more cases and deaths than both China and South Korea combined. Currently, Apple and Verelli are partnering with state and federal governments to amass a collection of patient data on their symptoms, recent travel, location, age. Currently, Apple and Verelli are partnering with state and federal governments to amass a collection of patient data on their symptoms, recent travel, location, age, and underlying health conditions. Microsoft and many other technology startups are also conducting digital screening to collect similar information. This news was met with concern, as several Democrats in the U.S. Senate have contacted Apple CEO Tim Cook and Verelli CEO Andy Conrad, asking how the companies intend to use the information they plan to collect and whether they will agree to refrain from using the user data for commercial purposes. In a letter to Apple, which was signed by Senators Bob Menendez and Cory Booker of New Jersey, Richard Blumenthal of Connecticut, and Kamala Harris of California, they affirm Americans should not have to trade their privacy at the expense of public health needs. As these discussions about security and consumer privacy arise, other possible complications of implementing these safety measures are brought to light. Jay Stanley, a senior policy analyst for the ACLU, stresses that location tracking apps are limited by the accuracy of the data and uneven distribution of smartphones among richer and poorer segments of the population, which could pose equity issues. He also says a lack of adequate privacy protections would impair consumer usage. While many Americans have cell phones, there is still an unequal distribution of smartphones, which are fundamental to downloading apps and using certain location features. While traditional digital contact tracing can be intrusive, researchers are working to develop ways of collecting data without compromising personal privacy and data. The Massachusetts Institute of Technology has teamed up with Facebook, Mayo Clinic, and other organizations to create an app that collects information using a technique known as differential privacy, which is a way of publicly sharing information gleaned from a dataset without identifying the individuals whose activities are represented. The app works in a way to scramble the data, provided so that the information cannot be connected to the individual, therefore eliminating the concern of the user being identified. The data would also be encrypted to ward off potential hackers from accessing any important and private information. They are also focused on ensuring that the app does not give the government constant access to private user data. Nevertheless, these safety measures all rely on consumers' willingness to make use of their online and cell phone data for the benefit of the public health. Moving forward. In terms of furthering my research, I plan to continue to analyze how some countries' security applications during this ongoing pandemic have and will adversely affect their public, even after the situation is over. I want to investigate the possible long-lasting and significant effect and impact that technology concerned with privacy could have on society. Specifically, how will the government and the companies developing these apps ensure that user data is not being misused for purposes other than public safety? I wish to emphasize that it is possible to use these safety protections correctly. I will use information developed from previous pandemics and explains the lessons learned. I will use information developed from previous pandemics and explain the lessons learned in order to prevent us from committing similar detrimental mistakes. Using data from other countries that have successfully implemented safety protocols such as geo-blocking and contact tracing, I plan to determine the effectiveness of these protocols and show the benefit that our highly technological world can bring us when fighting the COVID-19 pandemic. Information from the NIH and CDC will further help me describe innovations that can aid in slowing the spread of the virus. Thousands of people are dying every day due to this virus, and it is a global responsibility to stop the spread. These safety measures are of the utmost importance to public health. In fact, Michelle Mello, a health law professor at Stanford University, weighs that some precautions are arriving too late to make a difference. She says, "We kind of blew it on surveillance. It's pretty late in the game to be getting into that now. You really can't stand these things up in the middle of a pandemic." Since the U.S. is experiencing high rates of cases and deaths, it is important and imperative that we analyze the risks and gains of safety measures and enforce them as soon as possible. I want to emphasize the fact that although I realize the uneasiness to trust the government with important information such as data privacy, the pandemic will not slow down if we do not treat it. Thank you.